Welcome to the 19th Annual Depression on College Campuses Conference. My name is Todd Sevig, and I'm the Director of the Counseling and Psychological Services here at the University of Michigan, and which on our campus is the Student Counseling Center. And on behalf of the whole planning committee, I am just so happy and grateful that we're all in this time and space right now. I have a lot of joys in my work life, but one of them is to be a co-chair of this conference that now has 19 years under its belt. We did have to take a hiatus last year, as we all know, as things were unfolding. I still remember those frantic emails, Stephanie, when we were trying to decide what to do. And if anything we've learned this past year, it's the possibility of doing things in a new way. So I am just overjoyed to be able to host this conference for everyone who's attending right now in this new way. Obviously, we will all miss our 3D, physically in-person connections that we have at this conference, in the hallway, in between sessions, and maybe some of us will even miss the pastries that are on the table. But we're so happy to offer this experience. And I just want to talk for a couple minutes about this experience. We are still in person. We are still together. We still care about student mental health. Nothing about a pandemic can change any of that. That's why we're all gathered here together. You know, one of the hallmarks of this conference has always been what I sometimes call a multi-focus, multidisciplinary, multicultural, and multi-roles that we all play on a college and university campus. It's long been the vision of this conference that in order to advance our work with student mental health, we need all of us engaged to grow in knowledge, awareness, skills, behavior, action, as students, as faculty, as advisors, as mental health professionals, as researchers. And so each year we have attendance from all those groups. This is a beautiful thing, and as best I can tell, as I've seen in my 30-year career, that this is the only conference that intentionally has that as a focus. And for that, we're thankful to all of us who are here. So after these 19 years of holding this conference, I would like to offer that I think our campuses are in a better place, providing support and treatment for college students in mental health. I believe there is less stigma, there's more conversations happening, there's more allocation of resources, more awareness, increased advocacy from students. And we now have a map that may not be totally completed, but it's a lot more filled in than it was 19 years ago. And yet at the same time, it's a coin. The two sides of the coin exist at exactly the same time. There is more work to do. While we experience today and tomorrow, we hear the content, the presentations, that's really important. Yet the real value-added work here is that each of us go to our campuses, enact, implement. We learn from each other. We build on each other's ideas and work. And we hope today provides the stimulus for that. Another contour is that oftentimes we'll have people from a very small college, as well as big universities, as well as mid-sized universities. And while the content can be different in all those settings, we can learn from each other. But that translation, that energy, that inspiration, we hear something in this today and tomorrow, and we say to ourselves, I wonder if we could do that back home. That's the beauty of this conference also. So again, we hope today provides the stimulus for this. I do want to take a moment to acknowledge some people. This is a great entity. The strength is the collective entity that we provide, yet we know that it wouldn't happen without people. So Stephanie Salazar, who she has been in touch with a lot of people, a lot of you, she's been the engineer that has made this all happen. It's not the easiest thing to turn this almost overnight, if you will, into a virtual conference. So thank you, Stephanie. I also want to acknowledge a transition that we've had on our campus. Professor Daniel Eisenberg, who many of you know as the creator, director, founder of the Healthy Minds study, has also been an active campus member on our campus for many years. And last year he transitioned to one of those big schools out in California there. So he's still involved in our airspace, but not physically on campus. And we just wanted to acknowledge all the work that he's put in for our campus, to this conference, and the Healthy Mind study. And finally, a special spotlight moment, acknowledgement, heart energy time, if you will, our heads, our hands, a moment to acknowledge John Graydon as he transitions into other journeys, as he is changing some of his roles. This conference, for those of you who do not know, this conference was his vision, his passion, his leadership, and it simply would not have happened at all without him. So we need to celebrate that, give honor to that, respect it. And my guess is he will still be involved with all of us, those of us who know him. It also is a very nice time to acknowledge Dr. Srijan Jain, who is here with us, who has been named with regental approval as the new director of the Depression Center, and will become a co-chair with me in this conference. So welcome, Srijan, to this enterprise. So while the people may change as the years go on, this effort has not and will not. That's our commitment. And it's also due to all of you who are attending this conference, and simply all of us working together. So I invite us to just take a breath before we're on Zoom here for the next 5 hours. Take a breath and take that in, because this is really special. And it doesn't happen all the time without intention on our campuses. So let's have some fun today and tomorrow in the spirit of meaningful, rewarding work and listening and talking and hearing each other. And that's our invitation, and that's our setting of the table. And let's all metaphorically eat as we go forth. So thank you for listening to that. And now I'd like to turn it over to our opening panel, which I am super duper excited about here. This panel is brought to us by the Steve Fund. And for those of you who don't know, I think a lot of people do at this point, because they are just great. But for those of you who don't know, the Steve Fund is the nation's leading organization focused on supporting the mental health and emotional well-being of young people of color. In response to our current crisis, the Steve Fund formed a multi-sector task force of thought leaders, and they developed recommendations for mitigating the mental health risks caused by the COVID-19 pandemic. So our panel today are all members from this task force who have put in countless hours of work, who will share recommendations in how higher education on our campuses can meet the needs of students of color. So Dr. David Rivera will be our moderator today. Welcome, David. Dr. Rivera is a national advisor to the Steve Fund and associate professor of counselor education at Queens College, City University of New York. So welcome, David, and take it away.
Great. Thanks for having me, Todd, and thanks for that wonderful introduction and for just setting such a nice tone for the work that we're all going to be involved with over the next couple of days. It's an honor to represent the Steve Fund yet again. My first introduction to Ann Arbor and the University of Michigan's amazing campus was because of the Depression Center when the Steve Fund, probably 5 or 6 years ago, presented for the first time. And so it's just been a joy to maintain this collaboration. And we had the deepest respect for the work that's being done at the Depression Center and the amazing impact being felt on all the college campuses that have been fortunate to be impacted by the work there. I'm joined here by my fellow colleagues, esteemed colleagues. I'll introduce them a bit more later after I kind of set the stage for the talk that we have here today. So the three esteemed panelists that I have were all members of a task force that the Steve Fund convened shortly after the pandemic kind of hit. We knew that we had to galvanize our efforts, not only within higher education, but across contexts, across sectors in society, knowing that it truly does take a village to address any issue, but especially the issues impacting our young BIPOC students across the country. I'm going to kind of set the stage with kind of what we were kind of addressing, and then some of the recommendations to come out of the task force, and then we're going to get into the panel discussion, which is the meat of our talk here today. So Healthy Minds, you all are very familiar with Healthy Minds. They're also a very important partner of the Steve Fund. We partnered with them early on in the pandemic to kind of understand, kind of get a snapshot for what students of color were experiencing in particular in the months following the pandemic, or following the beginning of the pandemic, which we're on the year anniversary, right? It's kind of hard to kind of take in the gravity of the full year that we've been almost in this online distanced pandemic context. This study I found pretty remarkable in terms of the results, but in terms of how carefully the researchers were able to disaggregate the data, right? I think that we've been using the term students of color for a little too long and not disaggregating what's really composing students of color. So now we have the new term that's being used, BIPOC, Black, Indigenous people of color, which I think is a step closer towards disaggregating this very rich and dynamic group of identities, right? That can have some similarities in some respects in terms of the experiences with overall privilege and oppression that we encounter in all the systems that we navigate on a day-to-day basis, but that there is also a unique experience that people of color have once we kind of disaggregate and see what are specific racial and ethnic groups reporting. And then we can even disaggregate that even more, right? So one thing that I always harp on is disaggregating our data. I think for all too long, whenever we aggregate it, we're not doing anybody justice. We only know a little bit about pretty much nothing. When we disaggregate, we know a lot more about many things. And this study really is showing us that pretty clearly. We see that, even when we think about the type of support that students are experiencing, where do they go to? We see that some students are reporting less support from their college administrators, some students of color compared to other students of color, right? So American Indian, Middle Eastern, and Pacific Islander students, for example, reporting less support from their college administration than other students of color and white students as well. Finding that multiracial students, for example, were less likely to view their administrators as sources of support. I think it's important that we kind of think about what are some of those possible reasons. Maybe it's because many universities don't know what to do, quite honestly, with students who identify as multiracial, right? They're not fitting one of those very artificial boxes that, let's say, the census has kind of, for way too long, kind of categorized us and made us feel like we have to maintain one singular identity when many of us are kind of ascribing to multiple racial identities. One that kind of sits with me a bit more saliently from my context of a professor is that Black and Latinx students were less likely to view their professors as sources of support during the pandemic, right? We know that professors are sometimes the main people that students are coming into contact, especially students that are not involved in the student life of the campus, which many students of color aren't. But especially in this pandemic, the professors tend to be the consistent forward-facing folks of the institution. And this one is particularly concerning, given that we know that Black and Latinx students also experience significant disparities in terms of educational attainment pre-pandemic, but I'm sure that these issues have become a bit more disparate nowadays. A number of other issues that people are experiencing in terms of witnessing discrimination and experiencing discrimination. I naively thought that this transition to online environment was going to help protect some of the students of color from a lot of the microaggressions and overt forms of hate that they had been reporting experiencing on campus. But I was wrong. It doesn't really take anybody to interact with you interpersonally. All you need to do is pull up any kind of media and you're faced with an onslaught of microaggressions and other overt forms of hate, and probably even more so as people kind of feel that multimedia or social media kind of protects somebody in terms of anonymity. So we're seeing kind of even more of these egregious incidents happening. We are also seeing that certain populations, such as Asian American Pacific Islander students, early on in the pandemic, were reporting higher levels of hate crimes, direct hate speech, and also microaggressions. All related to, or a lot related to, how the pandemic was initially spoken about rhetorically. The term, I don't even want to repeat it, but using a country's name to identify a virus, which we know the World Health Organization says, don't do that. That only leads to discrimination. But the unfortunate leadership that we had over the past 4 years decided not to, and that caused a lot of harm that our Asian American Pacific Islander communities are currently experiencing to this very day, even more so directed towards older folks in these communities that are even more of a target. In my own city of New York City, we have 3 different Chinatowns, one in Flushing, one in Sunset Park, Brooklyn, and one in Manhattan that most are familiar with. And we're seeing that the older folks are being targeted. And so what can we do as a community to help protect even the most at risk? Looking at just in terms of the people's attitudes, the last bullet on here speaks about just a kind of a misperception that people are having in terms of who's marginalized and who's not. So as I was mentioning with Asian American Pacific Islander students, they were experiencing more discrimination, but they're also contending with this myth, the minority myth that they have been contending with, meaning that the model minority myth. Sorry, my language is a little foggy right now. The model minority myth, contending with that, right? Always performing academically better, et cetera. But that's also narrowly conscribed, right? And so we see at the last one that white students were more likely to agree with the statement that Asians are respected in the broader society, more so than what Asian and Latinx students are reporting, right? So there's this racial reality that isn't quite on target with what students are actually experiencing. Just early on in the pandemic, we saw depression and anxiety rates going up, and we saw flourishing rates going down. And I would imagine that those statistics are even a bit more disparate in this current day and age. And I know that the Healthy Mind study is going to have a whole presentation following this, and I imagine they're going to take a deeper dive into a lot of these statistics. So I'm kind of really interested in what that presentation is going to yield. We know that undergrad and grad students also were reporting higher experiences of depression and anxiety compared to their white counterparts. So the task force, one of the reasons that brings us here together, kind of why did we create it? What is the purpose? Who was on the task force, and what were the recommendations? Again, we knew that something needed to be done. One of the strengths of the Steve Fund from the very beginning has been the knowledge that there's strength in numbers. And so we've been really focused early on into the current day on maintaining our partnerships across the country with various organizations, such as the JED Foundation, which is also another presentation that I see scheduled later on with colleagues from the JED Foundation, this Steve Fund on our equity and mental health framework. We have partners in corporate America. So we had members from Zoom, members from Morgan Stanley, who are also involved in the work, members from the nonprofit sector, from the Hispanic Scholarship Fund, from other organizations that represent marginalized students as well, from various forms of higher education, from the community college level to the comprehensive university level as well, with a variety of leaders, college presidents, a provost, which Dr. Ocampo is a representative of, faculty, administrators, and of course, students. We primarily center students in our work, and we had representation from undergraduate and graduate students as well. And we also took with us a frame that we needed to not only think about the pandemic, the COVID-19 pandemic, but we also had to take into consideration the racial uprising that the country was experiencing or is experiencing. It wasn't new. It was just kind of highlighted more so last year, and that kind of momentum has taken a lot of speed, and we continue to see the momentum kind of take root. And then we just had a lot of the other issues that people of color. So whenever we have a human-made or a natural-made disaster, be it a hurricane, a medical pandemic, or a fire even, we see that communities of color are often taking the brunt of the disparities early on. And we see that in all sectors. We see that in education. We see that in the employment sector. We see especially women taking the brunt in the employment sector. We see it in the criminal justice sector. All sectors are going to see an increase in these disparities, and we're going to see primarily people of color taking the brunt of it. So one of the recommendations is that we needed to create trust and engage all stakeholders, right? In making sure that young people of color are supported from a variety of contexts and of stakeholders in society. We need to make sure that we're maintaining a genuinely welcoming and culturally inclusive environment, and then acknowledge the effects of racial trauma, right? I'm really excited is the wrong word, but I'm glad that we're finally calling it racial trauma, and we're calling it in the mainstream as well, racial trauma, right? This is this is how we need to kind of conceptualize the traumatic experiences that people of color have historically and contemporarily experienced in this country. So we developed some recommendations, both for higher education and also for the private sector, but I'm going to go over those that are related to probably the context that all of you are navigating on a daily basis. And so again, one is to build trust through racially trauma-informed leadership. Fostering trust is essential to supporting the mental health and emotional well-being of students of color, and leaders can build students' trust by acknowledging their trauma and its origins, right? Ranging from the intergenerational sources to the pandemic-generated sources that young people and pretty much everyone is reporting experiencing. And so we need to really further build on this trust by really going to the voices of the students to really inform us on what's going on from their perspectives. We also need to take a collaborative approach. Again, kind of this is it takes a village kind of approach that we know is needed, knowing that our college counseling centers, which have been doing such amazing work from their inception to the current day, but quite honestly, we've relied way too much on one unit within the institution to do all of the healing, right? Again, it takes a village. Everyone at the institution, regardless of the role that you're hired for, has the same mission of supporting student success, right? And we cannot drive that message in any harder. And so we need to include people from across the institution. We have to think about where students of color going naturally, right? Oftentimes they're going towards people that look like them. And unfortunately, most people that look like students of color are not represented in the faculty, right? They're not represented in higher level administration, right? They're often the folks who are doing the service work on campus, right? They're serving the meals, they're taking care of the grounds, they're doing vital services to make sure that all of us can have a campus environment that is going to help us to flourish and to thrive. But we often don't honor those folks as much as we should, and they play a very critical role in this messaging as well, and in these interventions that we can develop. We need to engage faculty and staff. You know, I'm someone who I pride myself as being both a student affairs practitioner, which is where I started my career and where I have a very active hat, and an academic affairs practitioner. I consciously chose to enter into the faculty role, knowing that, quite honestly, many faculty don't see themselves as student support service folks when they really should be. Right. And so how can we engage faculty more proactively so that they do understand their role and that they can, and they also have the tools for how to best interact with students and engaging in their wellness. Sorry, I'm just a little bit delayed going to the next slide. Okay. The last one, not the last one, but the fourth one is, again, we need to treat this as a priority. We need to treat student mental health as a priority on campus. And a part of this is, where's the messaging kind of at? Right? Our messages reflected in the mission statement, our messages reflected in the strategic plans that kind of help us guide the future of our institutions and organizations? Is it reflected in the descriptions of various departments and academic departments in the institution, right? How is the messaging being communicated to students that their mental health is a priority, that their wellness is a priority, that we understand it as one of those basic needs that needs to be attended to in order for students to reach that level of optimizing their fullest potentials? And then the fifth one is leveraging the community and external stakeholders to promote this education, the emotional well-being of students of color. Again, the partnerships are necessary, the communication, right? Oftentimes institutions by themselves are siloed, especially large institutions tend to be very siloed, right? And so how can we kind of break down those silos so that folks within institutions are speaking to each other and collaborating and sharing their resources? Oftentimes we don't need to recreate things. Oftentimes we don't need to even add more financial resources. We just need to reallocate and share things more effectively. But we also need that communication between institutions, right? Knowing that what's happening at our neighboring institutions might be able to inform what we're doing, and vice versa. There's a reciprocal relationship there. So how can we kind of better increase the communications that we're experiencing? For more information about this, please go to stevefund.org. You'll find the report embedded there. But I'd like to get out of this slideshow somehow. Let's see. Does this kick us out of it? Did I just ruin everything? Are we good? Okay. Awesome. So now we're to the show. I need to stop talking. We've heard my voice way too much, but we have my three very esteemed colleagues here with me who I had the extreme fortune of sitting on this task force with. We have Dr. Farah Abbasi, who is a professor of psychiatry at Michigan State University and a psychiatrist who does so much culturally informed work that's you're just going to learn from a lot during our conversation. We have Dr. Carlota Ocampo, who is the provost at Trinity Washington University in Washington, D.C. Also, I believe, a neuropsychologist, yep. Right? So bringing that perspective to our conversation as well. And then we have the soon to be, and I want to use that already, Dr. Siobhan Wellington, who will be graduating from medical school probably a couple months from now, I would imagine, at Quinnipiac University. Again, the next generation of medical health providers that's just going to they're already doing such impactful work, but I'm just really looking forward to seeing how your career develops in the years to come. So these are my three esteemed colleagues who are going to share their wisdom, share their strategies, and share what they've been doing to help create equity in their context. So the first question, it has to do with the creation of this task force. I'm wondering if we can have Carlota start off with this one. Why was it important to create this task force in the wake of COVID-19? And why is it important to acknowledge the racial injustice movement amid COVID as well?
Thank you, and hello to everyone. Welcome. We're so glad that you're tuning in for this very key discussion. Can't think of a discussion more important at this time, frankly. The Steve Fund has historically been devoted to the mental health and well-being of students of color in higher education. And we have always put forward information and resources around that particular issue. What happened in the current health crisis, let me put it this way. What happened with the current health crisis is it revealed that racism is a public health crisis. That's what happened. it revealed the structural inequalities that are embedded within our system that occur at every level, the environmental level, the local level, the individual level, the intrapsyche level, that racism is the root of much of the health crisis that we are experiencing. And the COVID-19 crisis, for many people, so for folks who may not have the same level of racial incident-based trauma that other people do, COVID was a crisis. It was a crisis. It through many aspects of the sort of weaknesses of the way that we organize our lives with respect to public health, threw those into great relief. For students of color, for people of color generally, and students of color or BIPOC students, in higher education, particularly, the COVID crisis layered over these ongoing other conditions and highlighted them. So the ongoing other conditions, and all of this sort of came to a flare at the same time, were the economic challenges that many BIPOC students bring to higher education, as well as the racial brutality and violence that occurred, that was thrown again into highlight this summer, but that we know has been ongoing for a long time. So there's this, sort of constant secondary traumatization that's going on for students as they continue to see Black and brown bodies brutalized, in public communication. So these things are all going on at the same time, and we recognize as a society that everyone needs help at this time. Everyone needs help. But guess what? People who already needed help now need more help. And the other point that I want to make about this is that we tend to see, society and social resources divided up as pieces of a pie and who gets what piece of the pie. But that is not an accurate view. This is actually about, if we dig deep down into those who need the most help and solve those issues, all boats rise, right? All boats rise. So when we address the deepest social problems, the deepest problems of social inequity at all the levels I discussed before, from the individual intrapsyche on out to the broader environment and even to globally, when we address those issues at every level, everybody's life gets better. So that's why the Steve Fund is in this work. And I believe that that's why each of us on this screen is so particularly dedicated to this particular issue that is again a key concern for making the world a better place for everyone going forward.
Thanks so much, Carlota. That was just the imagery that I was developing in my mind about those layers. And again, that when we can serve those in most need, that's going to lift all boats up, right? Everyone is going to benefit from that.
That's how it's always worked. When the least among us thrive, everybody benefits. Mm-hmm. That's just how it works. Mm-hmm. And the opposite works too, right? When some people hoard the benefits, everybody, everybody's world is worse. Everybody's worse off.
Which is a dynamic of racism.
Absolutely. Mm-hmm. Absolutely. It's like, I deserve this, you don't. Mm-hmm. Mm-hmm. Yeah.
So I would like to build on that. For me personally, I've worked in an academic setting all my life, and I have seen firsthand the impact of these health disparities, structural racism. To me, the work that task force has been able to achieve with this report is, forever we have focused on the students as something dysfunctional or broken. And I think we have put the onus on the students for their wellness, which is true. Each one of us have to take the responsibility. But the basic first important thing this task force has been able to achieve is change the narrative and put the onus on the system. Forever, as an immigrant to the country, it boggled my mind that Michigan State is an agriculture university, right? It started as that, but now it's identified as prominent public university of the country. It's interesting, I always talk about it, that when we import species or plants, we prepare the soil. We don't go and tell the animals or plants that we are bringing in, you have to get used to the system. We prepare the soil, we prepare the system so that they get developed roots. They will adapt over a period of time, but first responsibility lies with the system. And that's what my hope with all this work is, that the system understands and owns and is focused on their role, what their responsibility, the onus of making students feel included is on the system.
Mm-hmm.
Definitely. The system is who is sick. The system is ill.
Right.
I love that frame switch for all too long, especially even just in the field of psychiatry and psychology. We've pathologized the individual way too much without taking into consideration the system that is actually broken and sick. And so how can we expect anybody to thrive, right? Let alone persist and grow into their optimal ways of developing if the system, if the soil, right, is not created for their development.
And David, could I just follow up on that and mention that I think we specifically do that with racialized forms of trauma, because we put the onus on people of color. Like, why are you so angry? Like, what's wrong with you? Why are you paranoid? You know, it's like we pathologize people who are actually being victimized by a system that is actually ill, a system that is ailing, a system that is sick. And what we need to do is shift. We need to understand that we have structured society in such a way that people of color have experiences that are traumatizing.
Exactly.
Right? It's not their problem. It's not people of color's problem. It is someone else's problem. It is those who perpetrate those systems' problem to fix the problem. So yeah, I think that's thank you, Farha. I think that's such a useful frame shift.
It is.
To put where we need to address this problem. Of course, we need to treat individuals when they're sick, when they're ill, when they're exhibiting, problematic behavior. But the point is that what we really need to fix is a social system that creates these experiences that result in traumatization.
I think the sense of alienation that kind of contributes to this trust deficit that we kind of talked about in the Steve one. This sense of alienation, it's the responsibility of the system to become inclusive, to become accepting of all of us.
Right, to become inclusive and also to become equitable.
Equity.
We need both pieces. We need to include, but then we also need to, make sure that there's equity within that inclusion.
Yeah, that's so true. Equity, right? Not equality. We're not looking for equality. We're looking for equity. And Siobhan, we need to get your voice in here. A student who was on our task force who provided so much meaningful insight. I'm wondering, Siobhan, if you can talk about the same issues, but also why it was important. Why is it important for us? We should know this, right? It should be a no-brainer, but why is it important and necessary to include students' voices and to center them in any of these discussions about how to create equity in our institutions?
Hello, everyone, and thank you so much all for your insightful comments thus far. So I think it's important because the student of color perspective is comprised of multifaceted challenges that we've already pretty much highlighted. And when those things are ignored, it affects and is detrimental to our well-being and success. We're a growing population in this country, and it is important that our voices are heard. What I've been seeing and have personal experience is that we're being recruited to higher education institutions and the workforce, but once we're in those environments, they're not designed to support us. And as already been mentioned, even prior to COVID, students of color already were disproportionately impacted by various factors that had negative impact on their mental health. And so Just to name a few of them, that would be discrimination, social exclusion, educational and income inequality, food insecurity, housing instability, poor access to healthcare. And then when you add other layers, including sexual orientation, immigration or ability status, cultural background, gender identity, it becomes even more complex. And as many of us know already, research has shown that students of color are more likely to experience racism and bias on campus, feel overwhelmed in college, face more challenges in terms of career opportunities, mentorship, and paid internships. And there actually have been reports of higher rates of depression and anxiety amongst graduate students of color in particular. And what we also see is that students of color are often less likely to pursue treatment or support for their mental health concerns. And that is at least in part due to stigma, either within the culture or outside of the culture, in addition to the lack of diversity in the mental health workforce. So then when you add COVID-19 on top of that and co-occurring racial injustice, all occurring at the same time in 2020, it was an exacerbation, like as we've mentioned. We know that COVID-19 has disproportionately affected persons of color physically, in terms of illness and death, economically and psychologically. I have some personal anecdotes from students that we've kind of curated over time, and some of the issues that affected some of the students we talked to included grieving the loss of loved ones, stepping in to help family members financially and navigating unemployment challenges, advocating for relatives with COVID to receive standard of care. So this isn't even saying like care that is, better than, it's just standard of care in the hospital setting. That was from my friend who had COVID-19 herself, was a new mom, and both of her parents had COVID at the same time. And she was trying to navigate the healthcare system all at once while trying to get better herself. And then, of course, the discrimination that was already impacting certain groups, but then started to impact other groups even more so. And then the traumatization of continuously seeing bodies and people that look like us being murdered. Personally, I was studying for an exam during the month of May, and it was just week after week after week of hearing multiple people being killed. And for me, George Floyd's death was kind of like that breaking point. And it was a breaking point for many of us. Like, we just had enough. And so you're trying to navigate being a student or being a new employee somewhere, and you're just seeing people who look like you getting killed, and you're not hearing a school say anything about it. You're not hearing anyone offering words of support, and you're just like, what am I doing? How do I navigate this space? I feel so alone. I feel so isolated. It was a very difficult time. And I was so grateful to be a member of this task force because it allowed me to have a space to talk about what was going on and what I was feeling and how what I was experiencing. And in relation to this, many of my colleagues have been spending their time participating in advocacy efforts and educating administration on why anti-racism curriculum is important, why it's not just diversity, equity, inclusion efforts, but how do you improve those efforts so that students actually feel included and they do feel like their voices are being heard, addressing bias policies that are existing on campus, what supports that we need. So I know students would spend hours being in these meetings and nothing was really changing. We wrote a letter to the school, and that's my personal experience, but there was a letter that was written to our school and signed by multiple people. And it was kind of like, oh, that's really nice. And it was really challenging being in the space where like, I'm telling you how I'm feeling. This is what we're going through. Please do something to address this. And I imagine that we're not the only ones that experience that on our campuses. And of course, as you would expect, that takes away from students' academic work. And that affects people's mental health as well. So ultimately, I think it's important to seek student feedback and actually listen to what they have to say and think about actionable items in terms of how to make change.
Siobhan, you just gifted us with so much of your personal experience, but also what you know about kind of the general state of being for students of color, especially in this context. I hope everybody wrote everything down, right? There are so many issues. And I know the unfortunate truth is that probably students at many institutions are feeling similarly to you, that they're called upon to provide their very meaningful experiences, and just recounting them can be a source of trauma. So if we're asking students about their very intimate experiences, especially students of color, about their experiences with racism and discrimination. And we're inviting that to the table. But then if it's not being received and acted upon meaningfully, that's almost like a slap in the face. And so I'm wondering, what can we do to make sure that we're including students of color and their voices? We're honoring them, right? And that process needs to look a very certain way. How can we make sure that we're actually doing them justice when we include them? I'm wondering, I know that a lot of colleagues struggle with that, right? How do we involve students of color, number one, without using them, right? Or misusing them, right? And then how can we actually honor their voices and incorporate it into the work? I'm wondering what some thoughts are on that.
How I envision it is, on one hand, there's this huge vicarious trauma, stress, stigma. Then you want to stabilize, sustain, and support in order for them to get to the other end, which is success, and what success means to them. But the important piece as faculty or like people who can impact the policy, I think for us as our role is not to come in with our own narrative and agenda. And I think that's another thing I thought that Steve Fund is helping me is find that language that is reflective of the needs of our students. And I think the student, like as faculty of color, I also at times feel the fatigue of always being the advocate or being the face of, or assuming that I have all the answers, right? But to allow students that safe space where they can speak their narrative, how much, when, and where, and then give them that support and protection, that give them that security that you give us this and we will take this forward, kind of playing that intermediary role so that a student of color doesn't feel that they have to be intervening at every level. So that's why we need allies. We need advocates, we need allies, that kind of there should be a chain of this work has to be done at different levels, and we need a whole chain of support.
I'd like to say some thank you. I agree, and I want to broaden that out in the sense of, I'm a provost. So it's great to be in this role, and I often share that, I came up the way many others did, working my way through school and slowly moved up the ladder to gain this role because I wanted to be able to make a difference that was more than lip service. So one of the things that I think racially informed leadership can do in an institution is to perform, we were talking about an equity audit, right? Students of color are marginalized in many, many, many ways in our institutions, and many of those marginalizations can be unconscious because they've been perpetrated for so long, and they're embedded in policies. They can be embedded in syllabi in the curriculum. They can be embedded in public spaces at the institution. They can be embedded in the way we administer clubs, the way we allocate resources towards different kinds of activities and events, the way that we honor and lift up certain kinds of work products over others, the way that we engage students with the pathways into our offices, so to speak. There's just so many ways that we may be marginalizing students of color without even realizing it. And I would extend this to say, I'm using students of color. I also am thinking of students who may be first generation, who may not understand how institutions work and how to make their voices heard in a public space. They're developing, when students come to us, they're at a specific phase of their development typically. And they are developing these capacities to find their voices. They don't know this coming in intuitively. The most privileged of students don't. And so therefore the students who have dealt with the least degree of being privileged in society often, I mean, how are they gonna have it? And so we need to perform really an audit of like a top to bottom and bottom to top audit. Now, that sounds very, like how could we ever do that? Well, just start small, pick one thing and figure out how it's working and look at outcomes, right? Is it your student health center? Look at the outcomes. Look at the outcomes of how you're serving students of color. Is it your clubs and organizations? Again, look at the outcomes. Is it your classes and coursework? Look at the outcomes. Look at the learning outcomes among your students. I think that, students of color who are in a class where they might feel minoritized, are going to, they have this extra cognitive layer going on all the time, right? They're processing everything that everyone else is, but on top of that, they're processing the other pieces that come with being a person of color and walking into a space where one is not feeling welcome or has not always been welcomed, right? And we need to go in and we really need to do the deep audits to figure out, where is this happening? I mean, I'm going to propose this happening everywhere. And then eventually we need to audit everything. And then once we've figured out that piece, then we have to decide what are the strategies we can use to make these outcomes more equitable. And that really, we have recommendations in the Steve Fund Task Force, which I urge that everyone reads. Those specific remedies can often have to happen, from a very grassroots place. And those remedies should also include, right, the people that the policies are affecting as the remedies are being considered. I could give some examples of this kind of thing from my own campus. I'll give one example because I know, Siobhan, when we talked about this before, you said you thought this was a great idea. So I do think it's a wonderful idea. After this summer, with the racialized violence that occurred, as a result of police brutality and the massive, protests that happened, many of our students also dealing with COVID, also dealing with economic downturn, just felt themselves to be in this place of sort of, I'm not going to say helplessness exactly, but sort of like they're stunned. They don't know what to do. And so we instituted a program called Trinity Dare, Driving Actions for Racial Equity, that is an action program with a set of platform initiatives that can engage students with actual strategies to increase equity outcomes at the institution. And I won't go through the whole list. You can look at it on our website, but we had such a positive response in our campus conversations because the students felt like we were really A, acknowledging the problem, and B, as an institution putting forth a venue for students, not just to, which is fine. Expressing oneself is important, but that's just the first part, but, express themselves, but also get involved in activities that could have a positive impact on this particular issue at whatever level the students wanted to, right? So also it's not required, but it's here for you. And I think that, again, the institution coming out with a platform and engaging students with that platform can be, a real way to increase the participation of students and make them feel more welcomed and more like I belong here. My perspective is, I going through education very much felt that feeling of, do I belong here? The imposter feeling. And, finally when I got, this is in Michelle Obama's book, and then I'll shut up, but she was saying how she finally got into these rooms where these people were that she had always kind of looked up to and idolized and thought, these people are running the world. And then she gets in the room and she's like, wow, they're not smarter than me. And, that's always my message to our students is you belong here, and no one's smarter than you. Like, you're the smartest person in this room right now. Be that person. So we all belong, and all our voices are very, very necessary.
Thank you. As a mental health provider, I would also like to add one thing. So what I've seen, the compassionate fatigue of the system as well. So when I have approached them, when you're talking about George Floyd, and you know what the research shows, that one Black life lost in that way can lower the mental health of that community by 3 months. And when you have these persistent one after the other incidences happening, then you can imagine how this impact is constantly like being multiplied, you know. So as a mental health provider, we know there is a chronic stress exposure, and on top of that, there is an acute insult happening. So what I saw in the system, even when system is well-intentioned and want to be supportive, there's a compassionate fatigue, like where to go, how to really deal with it on an ongoing, everyday basis. Where, Siobhan, you're telling, and thank you for your courage for sharing that. You're telling us that how overwhelming it is for the student, but then I see the system is not prepared. So we what do we do? First of all, they use the lens like, oh, this is something we are going to deal with. This is not something we are going to talk about. Like maybe we will talk about George Floyd, but small incidences far away happening, we can turn a blind eye to that. It doesn't mean it's not going to impact me. As a Muslim, I've experienced this, that there could be an attack on Syria, and it's assumed that it doesn't impact my mental health. It does. It does affect. The communal trauma is constantly happening, right? But the problem becomes, what I see is they say, oh, we have put this resources on the website, the check boxes. Oh, there's a counseling center. There is a support group happening. I really want you, Siobhan, to guide us through this today and this is something I kind of constantly have to stand up and fight the system for, is that the chronic stress is there and you have the resources, but we can't turn a blind eye or deaf ear to an everyday ongoing traumas. It doesn't have to, you don't have to visually see a George Floyd struggling and dying for you to understand that this trauma is happening every day on our streets or in our lives. So please, Siobhan, how can the system improve on that, that there are chronic resources like for chronic trauma and stress available, but what about acute stressors? And I'll add why this is, again, important, because I'm doing a lot of suicide prevention work lately. And what I realize is, again, we approach, first of all, the suicide rates for white community is increasing, but still not like, it's still comparative, like steady, or what's the word, still where we were anticipating it to be. But for minorities, students of color, female of color, 5 to 8-year-old kids in Black community, these suicide rates are doubling and quadrupling. And what we are still approaching suicide as a sequence of events, suicidal ideation, planning, and then acting on. We are not taking in account that most young suicides are happening by impact of acute stress. That intense moment of feeling overwhelmed, helpless, and having that psychic pain, unbearable psychic pain that you act out.
That's right.
So definitely, as a mental health provider, that's where my concern is. One thing is ongoing trauma, but what are we doing about these acute insults, be it COVID, be it death of a loved one due to COVID, or unemployment, another George Floyd? Please, Siobhan, what can we do more as a system?
So I would say there's a few things. I know that, like, for some people, emails can be obnoxious, but I think when you see something that big happening and you're silent, you don't send any sort of message to say, wow, like, we know that what we've just heard about is really traumatizing, and like, we want to extend our support to our students right now. It just that makes such a huge difference, I think, because it acknowledges that I have students on my campus that are experiencing things differently from other students, and I want them to know that I do care. So that was something that I was really looking for at the time, and I was really frustrated. And it actually took multiple students saying something to administration for them to even send anything out. And it's like something that's so simple as just sending an email of support is not a difficult thing to do. But just open that conversation to say, we do care about you and we acknowledge that this is a difficult time for you. Another thing is mental health days. Now, I know that in certain settings that may be difficult to implement, but I think it's normal for someone to take a physical health day. But a mental health day is kind of viewed, no, you can only do that if you have some free time. But when incidents like that happen, some people need to step away from their clinical duties that day. Not saying it's required, but maybe, for some students, they might need to work through the clinical duties to take their mind off of it. But there might be other students who really just need to take the day to process what they've just experienced or witnessed. And so normalizing this idea that, hey, we know that this happened. It may be difficult for some students. If you need to take the day, please, by all means, go do that. I think that goes a long way too. And I mean, this is more of a long-term thing, but having more diverse staff and a more diverse mental health workforce is just extremely important. Time and time again, I've had people in my life who were actually open to seeing someone, but not seeing people that looked like them was a problem. And so they, they just decided not to go see anyone. And now they're sitting there dealing with these mental health issues on their own. And so even if it's, there are a few diverse faculty and I know, and it's hard for faculty too, because like you've talked about, you all have your own tax that you're dealing with too, because you're processing what you're seeing. And then now you're trying to provide support, but we do need you and you're important. I think it's really important that we have safe spaces for the students to really just process. I don't know, those are just a few things that come to my mind initially anyway.
And I think for me personally, when I'm helping someone a minority or a student of color, it's healing. The walking through something like this traumatic, it's actually healing for me too. So I need that space too. But again, the system thinks that the faculty is also, honestly, I've had these issues that they assume that the faculty is not experiencing this, that we are kind of somehow protected. It does impact, right? So we need to, that's another thing is maybe we need to really have mentally healthy faculty as well, dealing with their stigma around mental illnesses and trauma. So another aspect of suicide which concerns me is you have 400 physicians dying by suicide every year in this country. That's one or more than one. And if we kind of, like you said, disaggregate the data, it would be more in IMG group and then more in females. So that's something, I think, Siobhan, that's a good point, is mental health days and having that safe place where maybe we can just sit somewhere and hold hands or just even if it's in silence, even if there's no word, but the safe space or identifying safe people that I can process my trauma with. Thank you.
Well, the three of you just gifted us with so much practical information. Carlota, giving us that framework that you're using at your institution. Again, I could see it in my mind, just these various units, but also breaking it down for us in a very realistic, compassionate way of just try one, do one department, do one thing first, see if it works. And then you can replicate that as a template for how to do this work across other sectors of the institution. And I'm glad how you specifically called out certain sectors that may be overlooked, like student activities, for example, right? Mm-hmm. We have to think about, again, everyone in the institution. Siobhan, those very specific things that we could be doing right now for students of color, right? Racial healing, right, is an antidote to racial trauma. having spaces specifically for Black students, specifically for Latinx students, specifically for AAPI students, for Indigenous, for whatever you have going on your campus. If there are already going on critical masses of students of color, know that they are hurting, right? And that you can bring them together. One thing that I'm proud of with the Steve Fund, I recently developed a racial healing workshop with a colleague of mine, Dr. Marcia Liu, who does a lot of AAPI work within an academic institution. But we're finding that just, there's their rubrics. Boston College, Dr. Janet Helms, her group over there have developed the Racial Trauma is Real toolkit, right? That actually has a plan that you can do in advance, because we know we're going to encounter instances of racism if you're a person of color, right? We can plan for it. There are things that you can actually set in place, yep, right? Just with like self-care planning, right? Yeah. We can take that framework, but providing spaces for people who have a similar cultural frame to heal together, right? Just as Farah was sharing, our work with students of color, right, can be healing for us because it's a reciprocal Absolutely. Process. And Farah giving us all of those very meaningful things that you're doing at Michigan. I think that, again, the gifts that you've all just shared have been very helpful. One thing that I also heard is, Siobhan, we can't say it more. When we see something happening, we have to say something. I think of it, living in New York City, to see something, say something. I think that's global now, but everywhere. I think of the subway. I haven't been on the subway for a year though, so hopefully those signs are still there. But also like my mentor, Daryl Dwing Sue, was always kind of saying, we need to make the invisible visible, right? With silence comes complicity, right? And so just say something, right? Even if just acknowledging that these traumas are occurring, that this latest person that was killed is still going to have an impact, right? And so we can't get fatigued by this as well. We need to continue to address it and address it very forthrightly if we're going to serve our students correctly. I wonder if we can talk a little bit more, because I know that you all are doing such real meaningful work. What are some other practical ideas and interventions that we can share with the audience in terms of what students can do, what administrators can do, what faculty can do, again, to support students of color well-being? What else can we do? What are some other ideas that you have in action or that you just have brewing in your minds?
I can say so. We recently have a chief diversity officer, Jabbar Bennett, in the Office of Inclusion and Cultural Initiatives. And I do see the shift at Michigan State, at least I can say that it's very urgent, and they're being very intentional about it. For once, I see that they're trying very hard to have an impact at every level. My fear is, again, that it shouldn't be just like momentarily. Like, what I'm concerned about is that when something happens, an incident happens, we all get very riled up and we are like, oh yes, this has to be, but then it starts to kind of slow down, right? Or that we kind of take a step back and say, oh, we are doing enough. I think the compass, I see the needle shifting. We are finally moving in right direction. I personally would want a faster pace, but I also want sustainability.
Yes.
Because again, what happens is when we settle down for equality and we start mistaking it for equity. My biggest concern, that's how I'm always envisioning, is sustainability has to be there. That it shouldn't be one person is here today doing the right thing and he leaves or she leaves, or something happens in the country, government changes, and suddenly everything goes back. So we need to, this process has to be a very constant thing. And that's where I think my work is focused on.
I hear that. I hear you, lots of intentionality embedded in there, right? And the sustainability, as you mentioned, a lot of these issues historically have lived within one person or one office, but we know people don't own the institution. Well, people should own the institution, but unfortunately we're workers there, right? And we're at will most of the time. Our careers grow in various ways. But I think that idea of how can we make these efforts sustainable via institutionalizing them, right? So they remain a part of the fabric, right? And so that I don't need to be the one that always kind of triggers this to kind of get into action, but no, the institution now values it so much that it's part of the fabric. And how can we get there? I know we're running out of time, and I think that we've approached now going into the second year of this pandemic. And it pains me just to even say that out loud, quite honestly. But there's going to be additional challenges. Just every morning that I put NPR on, that's my morning kind of routine. I just hear more disparities, more issues. Like the one this morning was on the differences racially between parents and how they feel about sending their kids back, and how Black parents are saying no, more so than white parents are, right? There's that distrust of the system, right? Which makes a lot of sense, which is also impacting the racial disparities in terms of the vaccines and who's getting them and the cultural differences there. So I'm wondering, as we kind of wrap up, what are additional challenges that we should be looking out for so that we can help prepare ourselves as much as possible to attend to them?
David, could I make a comment? You said, whose responsibility is this? A lot of us think the responsibility is the chief diversity officer, whose responsibility clearly is that stated in the, strategic plan of the institution, the organizational chart. But the responsibility for this is all of us. It's institution-wide. And I think one thing that's important for administrators to do and others is to set specific targets of where you want to get to. For example, you might say, right now our graduation rates for Black and Brown students are 55%. I'm just making this up. Let's increase those to 65% within a 3-year time frame. So now you have a target. Now you backwalk and you say, how can what supports do I need to put in place to make that happen? What are the needs of this population so that they can be supported to achieve this institutional outcome? Then everyone has to own that outcome. Like we're working towards this thing. Let's own it. Let's figure out what the pieces are. Some of the pieces could be, maybe we need to examine the curriculum. Maybe we need to embed inclusive excellence principles in our curriculum. There are inclusive excellence principles that can be embedded in curricula. Okay, maybe we need to figure out whether there are additional financial supports that are necessary. Maybe we need to figure out whether there are additional ways that we can make our policies flexible to account for students whose lives may be organized differently than other students' lives. Maybe again, a lot of the things I talked about before, when we do an equity audit, figuring out what those pieces are. So we need to reach, as per Siobhan's point, reach into the population, get students to engage with us about what they need, and then provide those things. And that requires institutional commitment. So when I say institutional commitment, I'm talking about energy, time, and resources, and highlighting that and forefronting that. And I would suggest that this is important to do, kind of how I started out by saying that all boats rise when we do this, because guess what? If the graduation rates for the Black and Brown students at your institution increase, your graduation rates increase across the board. I mean, that's how that happens, but it doesn't happen without intentionality.
As a mental health provider, I would say mental health. The campus, the institution's mental health, provost's mental health, faculty's mental health, and then of course, students' mental health.
I'll be calling you, Farha.
Please. I honestly...
I'm going to model this. Teasing.
It's so sad that we just think of illnesses. We are not thinking of wellness and resiliency. Where is the resiliency is gonna come, right? I still feel the mental health is on the fringes of the policy, not central. And something small like Siobhan is saying, Mental Health Day. As soon as you say it, it would be like, here comes an excuse. Right? So the stigma around mental health. So I personally think we really need to invest in mental health. My always biggest thing right now is visibility is viability. So we have to continue to unmask and continue to identify these needs and focus on it from mental health and social equity lens.
Oof, yes. We can't say the term mental health enough, right? We need to, I'm glad that I'm hearing it more often, but we need to continue promoting mental health as a basic need that needs to be attended to before anything else can happen. Yeah.
Excuse me, Dr. Rivera. I know we have some questions from the audience, so I think we're going to send those over to you if you're willing.
All right. So are we cool transitioning over to the Q&A?
We will need to start meeting beside presentations.
I know, we will. Yes. So there are a number of questions coming out. I will give the first one. Given COVID implications, it's felt so challenging to foster safe spaces and build relationships for BIPOC and other underrepresented students on our campus. How have you worked with or through the barriers of not being able to connect in person? So what have we been doing with the online context? Anyone? Feel free to.
I think as far as our services are concerned, we have switched to telehealth, which actually has the advantage that you can access care now, just even if you are not, I mean, I've seen students who can barely get out of bed, can still, have these services on their phones, on their laptops. But on the other hand, if you're talking about disparities, not everybody has access to internet. So that was the challenge. But everybody, as far as I understand, mental health is concerned, have transitioned to online and are trying to provide a lot of support groups, therapy, and other services. So this was the best we could do.
Yeah, I'll share just briefly that in the switch to online, especially here in New York City, where sometimes students will spend 2 hours or more one direction to get to school, right? 2 hours or more, very common. I run a leadership program for all of CUNY students, and my Staten Island students takes 2.5 hours each way for a 3-hour program, and they would do it. I'm noticing that there's actually been more access now that we're online system. More students are turning out for events, and so we've been really galvanizing on that online modality that has really created more equity in terms of access for students in our system.
Well, just to address some of the structural pieces, we instituted a laptop program for students who didn't have their own electronic devices, using some of the CARES Act money, which we targeted towards students' needs. Beefing up Wi-Fi on campus for students who might not have Wi-Fi so that they could come use the Wi-Fi in the parking lots. For example, sit in their cars, use the Wi-Fi in the parking lots and do this in safe ways. Because, some of our students were using Wi-Fi at McDonald's or whatever because they didn't have consistent Wi-Fi at home, making those things available, but then making the community spaces available. So one of the things that I think has been fantastic for us is we have a weekly campus conversation, which is led by the president. And it's very important to have highest levels of leadership in this. And Siobhan, you were saying earlier about having the institution, acknowledge some of what's going on in the world. I mean, some of our earliest conversations were around issues of racial violence and police brutality. So that the students could come and tell us how they were feeling in this open forum. So who engages in this? The president, upper level administrators, faculty, staff, students, pretty much everyone across the board, adjuncts, adjunct instructors, everyone in the community is invited, and it happens regularly Thursdays at 4 p.m. and people know it's there. So sort of just figuring out, we can't be on campus together. So how can we create a community that everyone knows is going to be there? And it's been so amazing that I think some of this we might actually take forward. When we say, what will we keep post-COVID? We may even keep this because, as you pointed out, David, it enables more people to engage when they have the resources to do it. So you have to do everything. You can't just like create the community and not provide the resources. You provide the resources, you create the community, and then you bring those things together. Perfect.
Another question came up about, so we know that we need to create parity, right, with the electronic resources that we're using. And so thankfully, like my institution was great about providing tablets, providing hotspots, right? Really trying to give students what they need so they could take advantage of it. But then we come across in New York City, many homes are multi-family homes, so privacy, right, that we're getting into. So lots of issues. Another question that's related, which I think is really important, is accessibility. So what about students who, for any reason, maybe an accessibility reason or not, where they don't want to participate online or they can't? Maybe they're visually impaired, right? Maybe there's some issues with privacy, so they can't really show their equipment off. And what can we do to help ensure that those students are also attended to with the same respect and the same opportunity that other students are?
First hope is that we are at the tail end of COVID and we start transitioning to some in person. Another model that I'm really working on and trying to write grants for is what if we create these telepsych spots in, let's say, a library setting where there are rooms allotted for it. I've been talking to a Carefree clinic that if we allot one room, which gives them the privacy, and they will have the support system of the rest of the, even hospitals should have these rooms created. So I think this is something, and we can bring, more services for hearing impaired and visually impaired, kind of technology, improve the technology or create technology support that can provide them. I think I do understand that this model is going to stay. Because the point that you made that it, on one hand, it is improving access. It's just we have to be more innovative to how do we overcome the disability or the disparities? How do we overcome and be more innovative around it?
Mm-hmm. There's a whole literature now on turning cameras on or off in classrooms. I'm sure we're all familiar with this. We found that what was helpful was creating a campus-wide policy that students did not have to have their cameras on. I won't go into the whole background on that, but basically, students don't always feel comfortable having their cameras on for a variety of reasons. So we made a policy that they didn't have to do that. Faculty and others in the institution pushed back on that. And so again, we had campus conversations where we brought people together so that faculty and students could hear each other's points of view on that and come to a conclusion. The end result was that we kept the policy. Students do not have to turn their cameras on, but they do need to engage. So another thing that we did was we provided resources for trainings for faculty to learn how to engage in virtual modalities. So again, we're shifting from, this bad student, isn't turning on her camera, is she really in class, to how can the faculty who are responsible for delivering the curriculum make their curriculum engaging so that students will be in class and will engage with that. And this is we're not inventing the wheel here. There's been virtual learning for a long time. Some of us might only be doing it now, but guess what? There's an entire body of literature on this, and you can hire consultant instructional specialists who will meet with your faculty and teach them how to do this. It's great. So, there is a solution to every issue. As administrators, my job title is fix the problem, right? So we just look at what it is, we figure out what are the pieces, and we get—
Carlotta, can I add that the system take the responsibility of fixing the situation?
Well, right, I'm the man. People always say, I used to say, gotta go to work for the man. And sometimes I look around and I go like, wow, I'm the man, so, I mean, metaphorically, I know that could be loaded language there, but for those of you around in the 60s, you might have a sense of what I was talking about. Not that many of you probably are, but we used to talk like that. So anyway, but my point is that, that's the whole point I was making before. When we get into these positions and we realize that there's no one around here smarter, we can start looking at what the problems are and making the changes.
Mm-hmm. I love that. And I love that flip of the frame as well, right? This is not a student issue. The students aren't the ones that are incompetent in terms of utilizing the online technology. They often actually know it better than we do. It's,
Right.
it's the instructional modality that's being used. And like you said, Carlota, this online instruction has been going on for quite some time, right? There are so many resources, and we shouldn't act like this is something that's just new. Online teaching. No, that's been going on for some time. And we need to think about.
I would just quickly add one thing, David. One thing that we haven't really, in mental health field, we haven't figured out is, God forbid, if there is violence happening in the home and the students are stuck in that situation, then how can they access therapy or, any support? How can you provide them if the center of the trauma is right there?
Mm-hmm.
So that's why I think we need to give them more access to public spots, safe mental health with privacy and mental health support has to be provided, make it more accessible to those who can't do it from home.
Completely agree with that, right? That we shouldn't assume that everyone's context is the same. Kind of, someone was asking about different things we can do. I always think approaching something from a point of cultural humility, right, where you are not applying your worldview onto the worldviews of other people, is the best place to start, right? And to approach it from a place of curiosity, which is the opposite of a place of judgment, right? We're curious about the situation. We're wondering, we're not just assuming that I think it's, quite honestly, we assume the worst in our students. We assume they're all going to cheat. We assume that they're all going to not want to show up, when it's quite the opposite. I think that we've taken these generalities and we've used them as kind of our guides very, very incorrectly and at the cost of the student's experience. We have like 2 minutes left. And so why don't we all share one final thing that you would like the folks on this in the audience, the virtual audience, what would you like them to walk away with? Let's start with Siobhan. You can tell us what do you want us to walk away with?
So I'd just say addressing the mental health needs of students of color is a continuous process. So always being open to hearing about our experiences with, like you just mentioned, a humble and empathic mindset. And extending grace to yourself and others in this time. It's a very challenging time for everyone. And we're much stronger when we all work together instead of against one another.
It's beautiful, right? Extending grace to ourselves and others. I think we can't hear that enough. Thank you. And thank you for being here today, Siobhan.
Thank you for having me.
Farah or Carlota, what would be one thing you want to leave our folks with?
I would like to, because again, I'm focused on policy and administration right now, is individualize. Don't go with standardized. Don't put labels. Don't try and put people in boxes. We need to focus on individual need. How trauma or how COVID, how educational burden, how is it impacting that one individual? And we have the capability and resources to be able to do that.
Completely agree with that. It reminds me of the vice president of student affairs at my undergrad institution was Jim Hurst, the counseling psychologist, and he'd put little plaques everywhere saying, each student a person, right? So that we wouldn't forget, so people wouldn't forget that these are people. Right.
Yeah, we are not heard. We are like, we all have our individual weaknesses and strengths.
And to connect that up to the systemic level, systems, we talk about systemic racism, systemic inequality, systems are made up of people. We can change the system, each one of us, by changing our part.
Oh, that's a perfect way to end this panel. Thank you, three, for sharing your brilliance with us. Thank you, Depression on College Campuses, for bringing the Steve Fund into your world again. We hope to continue our partnership. And thank you to everybody who is with us taking in this information. We wish you all the best, and we hope that you do well over the next couple of days at this conference.
Thank you.
Have a good day, everyone.
Yeah.
Thank you.
All the best.
Thank you, Steve Fund. I think that was a wonderful way to start the conference. And I love that hope that we can change the system. So I do want to say that if anyone is interested in diving more deeply into the equity and mental health framework, they are having another session later on this afternoon that you should check out. And also, if you're looking for the framework, it is in our virtual resource room. So we're going to start our concurrent session at 1:45, but I just want to let you know that who I am and introduce myself and do a little bit of housekeeping quickly. So I'm Stephanie Salazar, and I'm Outreach and Education Program Manager for the Depression Center and part of the Conference Planning Committee. So you'll see me sort of floating around a little bit along with some of the other Depression Center outreach staff who will be moderating the other concurrent sessions. So I do want to just shout them out: Taylor Paul, Jeremy Fallis, Lizelle Salazar, Haley Crimmins, and Danielle Taubman. Thank you to them. Feel free to ask us questions at any point. The few housekeeping things about the platform. I do want to draw your attention to the reception page. If you have not already checked it out, there's a lot of important information there, including how you can view the full conference program with session descriptions, speaker profiles, and information about continuing education credits and evaluations. So do remember to continue to sign in and out of each session using those polls for continuing education. I do want to mention that we are recording these sessions, and they will be available for viewing by registered attendees following the conference, so look out for that. In addition, we've purposely built breaks between each session, which are great opportunities to stretch and move your body, take care of yourself, whatever you need to do, but they're also really good times to visit, again, that virtual resource table. And we have a speed networking area. For the networking, the platform will match you up with another person, another attendee for a 3-minute conversation. And it's a really cool feature of this platform and a great way to connect with new people. So I encourage you to check that out. And then I do also want to remind folks to stick around for the poster session this evening. Each presenter will be giving a lightning talk, and then you'll have the opportunity to talk with them more about their research in a breakout room. So I think that's going to be a really cool, fun thing to check out. So please stick around for that. And with that, please explore the platform. I want to thank the Steve Fund again and enjoy the conference. Thank you.